Hello, good day everybody. This is Dr. Deepthinandan Reddy. I'm a shoulder, elbow and hand surgeon at Yashoda Hospital, High Tech City. Today we are going to talk about some common topics and questions we've been asked on Google. We have some interesting questions about the shoulder, elbow and hand injuries and hand problems which people have been asking on Google. It's very fascinating to see how the questions are. So there's somebody here asking that is surgery the only option for torn shoulder ligament? Can we just throw some duct tape on it and it will get better? Come on, this is not the type of questions we'll be expecting for a professional to answer. A duct tape will not fix a ligament tear. But there are some genuine questions like, why is surgery needed for shoulder injuries instead of rest of physiotherapy? All shoulder injuries do not require surgery. There are only few where they don't heal with normal human healing process. We go ahead and do the surgery. Most of the time, resting for the initial period and then rehabbing the shoulder will help improve the shoulder function. But assessment is the key. If we miss injuries like muscle tears and major ligament tears where you have dislocation of the joints, these will be a problem in the long run. For example, if you have a rotator cuff tear, which is a muscle in the shoulder which tears, if this tears, it is inevitable that most of the time we have to fix it because these muscles, when they are torn, they are pulled off the bone. So they will not going to grow back and heal. So a duct tape is not going to help this. What you need is surgery to fix this muscle back onto where it belongs. So you get normal function in the shoulder. Should I be worried if my wrist swells up occasionally, even without an injury? That particular type of problem is something we definitely need to look at and investigate, because if you have a swelling in a joint, may it be a wrist, elbow or the shoulder, we need to find out why that the swelling is come and what is the main reasons for it to control it initially itself. Because if the swelling can persist and if you have inflammation in the joint which has occurred without an injury, that means there is some process in the joint which is causing this irritation. So we need to find out the root cause. It could be rheumatoid arthritis, it could be gout, it could be any other infection like so. So seeing a doctor, getting it evaluated is very important, because if this inflammation persists long term, it damages the joint and you may require changing the joint if it is very worse. So prevention is better than cure in both these tears, the tear of the muscle and the swollen joint. We also have one question which is a very common thing which I see in my clinic, is that my wrist clicks when I move it. Is something wrong with it? If I move my wrist, you can hear that, and that clicking is not a problem. It is just the fluid displacement in the joint which causes that clicking. There are various theories about why clicking happens in joints, but I believe that it is the fluid displacement which causes this. So there's nothing you have to worry about. But if the click is painful and is happened after an injury, that definitely needs looking at, because that will need investigation to find out if there are ligament injuries in the wrist joint itself. Especially the wrist, where it is a very complex joint with 8 bones attached to each other with small ligaments. If the link between these bones are lost, then we get a problem. That is why assessing them, getting them treated correctly is very important. Now we have another question about frozen shoulder, very favorite of most people. A lot of people think that any pain in the shoulder is frozen shoulder. It is not. And it says, can a frozen shoulder really make you feel frozen in time? No. There is another question which says that, can frozen shoulder make you the one arm bandit forever? No. Because frozen shoulder is something which we can treat. We can make your shoulder normal if the diagnosis is right. First of all, getting the diagnosis is important. Frozen shoulder can be mistaken for arthritic joint, which is different to a frozen shoulder, and the treatment for that is totally different to a frozen shoulder. So seeing a shoulder specialist who can assess that joint better and investigating to find out what the cause of that stiffness in that joint is important. Come back to the basic question, what is a frozen shoulder? Frozen shoulder is nothing but reduction in more movement in your shoulder joint. That means a patient is not able to lift the arm up even with the support and has pain and is unable to go beyond that range even if you push it. That is frozen shoulder. This can happen because of inflammation or swelling around the shoulder joint, and that tightens the joint up completely. That's the reason treating that inflammation and stretching this joint is important. If is not better with exercises and medication and injections, these are the initial management plans, we go ahead with surgery to release this joint. So, will you be frozen forever? No. That's the answer to this question. So, there's another question here which says, can a frozen shoulder be fixed with a good old stretch or a hug? Yes, it can be, but you need to stretch that joint out gradually. Nobody should forcefully pull it and make it stretch forcefully, because that increases